Hi, I'm Dr. Greenapple from Thrive with this week's Monday Motivation. COVID-19 is still here, and what we're seeing a lot in this practice are the long-haul COVID patients. Most of them are either still having loss of taste and sense of smell or brain fog. We've even seen numbness and tingling to the extremities and even some GI upset. We're going to focus today a little bit on what I'm seeing mostly, which is brain fog and what's called anosmia, which is loss of smell, and dysgeusia, which is kind of a different or taste alterations. There's lots of new data coming out. They're saying now there's well over 1 million people that are still having these long haul symptoms. And it's due, we originally thought it was due to some of the olfactory nerves in the nose that were being burned out, and now we're finding out it's really truly a brain inflammation. There is a great study that was done in March of this year, 2022, and I believe the title was even a mild case of COVID can lead to some brain dysfunction. The epithelium is the tissue inside the nose, and we're seeing that there's messenger signals in there that talk to the brain. And as a matter of fact, the front of the brain is called the olfactory prefrontal cortex, and that's right where the taste and the smell go right through that area, and that's where they're both being affected. So we're seeing things on MRIs are showing swelling. We're seeing difference of cerebrospinal fluid and even different sizes of the brain patterns. So there are many ways that we can try to address this in Chinese medicine. Some acupuncture studies have come out which are showing very good efficacy, and that's what I'm using in this office with specific frequencies. And we're also using what is called exercising of the nasal passages. So what we do with that, there are essential oils, and these are just a few of them. Essential oils, just like taste and just like colors, there are 4 or 5 of them that we want to hit. So we want to do what are called exercises, where you'll either take the essential oil, put it on a piece of cotton, or just put the bottle up to your nose and you sniff hard for about 10 to 20 seconds. And we want to get all those different patterns. So we're looking for mint, like eucalyptus or peppermint. We're looking for floral, and that could be lavender or rose. We're looking for citrus, like lemon or orange. And then finally, things like cinnamon and other types of spices. With that being said, we're doing exercises with that. We are also doing the electroacupuncture and then something called photobiomodulation. What that is a laser. So this is a small laser. This is just 50 milliwatts, and literally it's just a red light of 645 nanometers. And we're putting that into the nasal cavity or around the nasal cavity, and this is stimulating regrowth of neurons as well as getting rid of some scar tissue that's forming. So unfortunately, COVID is still here. We're seeing more and more of these long-haul situations, and we do know that the virus is getting to the brain, and whether that's really getting into the brain or if it's just hitting the nerves that are now messing up the messengers, whether the message going up is sensory or the message coming down as to what to do with that information. So there are things that we can do. Again, because I like to practice Eastern medicine, so I do a lot of acupuncture and things like meditation and Qigong, because that is a form of meditation. And as we meditate, we're quieting the mind. There are things that are called cognitive behavioral therapy. I do both. I do mindfulness and CBT. I actually do mindfulness-based cognitive therapy. Cognitive therapy is where we're replacing. So what we're doing is mindfulness, we're just being aware, and then we will think of a memory, because the scent goes right to the memory center of the brain as well. That's why memory can be so important, and that's why when, for instance, myself, if I walk into a sports store and I walk past the baseball gloves, I smell that leather and it brings me back to as a child. I played a lot of baseball. These memories are very, very important. So when you close your eyes and you do these exercises, we want to entrain one of those memories into the heart, into the brain, and then the scent will possibly come back. So with that being said, if you're having any of these symptoms, feel free to give us a call. There's going to be an article attached to the bottom of this video with a lot more details and information. Until next week, have a good week.